Well, we're doing it at a wellness clinic today, and essentially what that is that we're looking at people's blood pressure, their pulse rates, and as well as things like blood sugar if they so desire. And what that's doing is that's giving them a better baseline, so if they go see their physician, they'll have something to take with them, their blood pressure and their pulse rates taken outside of the doctor's office. So not just while they're in the doctor's office they get these vital signs taken, but also outside, so now the doctor has something to compare it to. Also it gives us a chance to talk about things like hypertension and diabetes and ways to help prevent, and if they do have those kinds of situations, ways they're going to be able to manage those kinds of diseases and disease processes.
So tell me, just in plain language, why do people need to get their blood pressure checked?
Well, it's for their overall wellness, and we want to make sure that people's blood pressure is under control, because blood pressure is one of the leading causes of stroke and as well as heart attack. Let's say in a wellness clinic we find someone whose blood pressure is a little bit higher than normal. We can then suggest that they be followed up by their physician to be able to monitor their blood pressure, and if so needed, they can go on some medications and start some kind of medication regime to try and reduce and maintain a lower blood pressure.
Gets quite tight.
It does get quite tight. Sometimes people find it uncomfortable. So your blood pressure is 128/90. Typically normal, textbook normal is 120/80. But there are many factors that are involved when we're doing, especially a clinic like this. We're in sort of a public area, so sometimes people get nervous when that happens. Same as if you go to a doctor's office and you get that white coat syndrome, people's blood pressure may rise. That's one situation. Maybe it's after lunch and you've had a high sodium intake diet, something like that could also elevate it. People sometimes come in just from a cigarette, that can also elevate their blood pressure. And we also ask people if we find that their blood pressure is a little bit higher than normal or outside the normal range, if they've had any recent symptoms. Headaches, dizziness, perhaps even chest pain sometimes and shortness of breath, because we want to make sure that if they say yes to those questions, we say that next time that happens, you need to call 911. Or if it's sort of to a lesser degree it's happening, they need to be followed up by a physician for sure.
Well, thank you very much. It's good to know I'm normal.
I'm Cindy Nicholson, Deputy Chief of Program Development and Service Quality with Toronto Emergency Medical Services. I'm here at Metro Hall as part of our EMS Week activities. We're putting on a cardiac safe city display, a display for our communications center, and a wellness clinic, engaging the public and promoting what we do at Toronto EMS. We're a fairly young industry compared to our other emergency service partners, and we are honored to have a week recognizing our profession, giving us the opportunity to engage the public, to understand what we do, and giving them the confidence to call 911 at any time for an emergency, knowing that they will have world-class paramedics arrive at their home and treat them. Thank you again to the citizens of Toronto for your participation this week. We look forward to seeing you next year during our National EMS Week. Thank you.